Do you know that wrong information has prevented a lot of women from seeking the appropriate medical attention? And this has really led to loss of lives. And because of that, I am here to debunk those myths known about fibroids. So, you're welcome to my channel. If you're seeing me for the first time, my name is Peace Tracy. I'm a Nigerian trained nurse and midwife who currently practices with NHS England as a registered nurse. And in today's video, I'm going to be telling you about these myths of fibroids and then the real truths behind them. If this sounds interesting to you, please stick with me and I'm going to be debunking them. In fact, I have 5 of those myths to debunk in this video. So number 1 on the list is that fibroids are cancerous tumors. Well, this is a well-known myth among many people, and many patients, when given this diagnosis of fibroids, they always ask this question: is it cancer? What should I do now? Well, I am happy to tell you the good news that fibroids are non-cancerous tumors. So when you have this diagnosis, speak with your medical practitioner regarding the most appropriate treatment, especially if you are symptomatic. Number 2 on the list is that surgery is the only treatment for fibroids. Wow, this is a big lie, because most women who have fibroids are actually asymptomatic. In fact, majority of women who have fibroids do not really know that they have fibroids because they are asymptomatic, and as such they do not require any medical intervention. So those who are really symptomatic have other kinds of treatment, which could be the use of medication or surgery. So surgery is only there when your medical practitioner has advised you for it, depending on your symptoms or the location of the fibroids. Then the 3rd on my list is that when you have fibroids, you can never be pregnant or have a successful delivery. This is a big lie, because as I mentioned earlier, most women have fibroids but they are asymptomatic, and in such cases, such women usually do not have any problems with conception, and they go on to have healthy pregnancies and a smooth delivery. So fibroids can only cause infertility depending on the location, and in my previous video I mentioned about it. If you would like to know more about it, please watch my previous video. Then there is another misconception about fibroids, and that is that hysterectomy is the only solution for the treatment of fibroids. Guys, this is not true, because many women who have fibroids have had different kinds of treatments which were successful. In fact, to begin, hysterectomy means the removal of the uterus. So it is usually the last resort. That is when other methods of treatment has failed. In my previous video, I mentioned other kinds of minimally invasive procedures which are being used in the treatment of fibroids. Only when these methods fail, then your healthcare provider, your medical doctor, might ask for a hysterectomy. And that is if you accept to go in for such a surgery, because many women really do not want it, especially if they are still of childbearing age and still have the desire to get pregnant and have children. These are most of the misconceptions that people talk about regarding fibroids. And then the last on the list is that when you have fibroids, you will always have heavy bleeding, or that if you are always having very serious bleeding during your monthly period, that you probably have fibroids. That is also another lie, because as I mentioned earlier, many women who have fibroids do not have any form of symptoms. So in some circumstances, women who have fibroids experience heavy bleeding, not in all circumstances. So my aim of giving you all of this information is not for you to self-diagnose yourself or go on to self-medicate. No. The reason I am giving you this information is so that you will be informed and not be deceived by anyone. Also, if you have any symptoms, as I mentioned in my previous video, please do not hesitate to go and meet your general practitioner or whoever it is that is a medical doctor, probably a gynecologist, to give you an appropriate diagnosis based on your symptoms and then the most appropriate treatments. So do not forget to give me a big thumbs up. Also, drop your comments in the comment section if you've got any questions or you know about any other misconceptions which I did not mention in this video, because I believe there might be others that I've not heard of before. Please drop them in the comment section and I'll be happy to know about them. Thank you for watching and bye for now.